All right, so Carl, we've been on quite a journey the last few months. Obviously, I think it's fair to say before our paths crossed, you were on a bit of a going around in circles situation. Do you just want to tell the people watching this video just a sort of brief summary of what your situation was and where you've been going round and round?
In 1993, I was in a car accident. I was out of it in the back of a car, drunk, and I basically got ragdolled in the back of a car crash, and I woke up and the car was in pieces. Anyway, I found myself home. From that moment onwards, I've been going to GPs and hospitals and whatnot, and they told me there was nothing wrong, just stretch. It took from 1993 to 2008 to get diagnosed with disc protrusion and issue at L4, L5. And subsequently from then, I've just been going around in circles with 7 bilateral facet joint injections, 4 denervations, and two epidurals that did absolutely nothing. The facet joints, they gave me some relief, but it was very temporary. And had I known what I know now, all of those facet joint injections with all of that cortisone has probably made my back, or weakened the structure in my back, and I wasn't told that at the time. Had I known, I probably wouldn't have done all those injections. That being said, at the time, I would have paid or ripped your arm off for some relief. So that brings us up to the present day, where I met Rob Shanks, kindly, like you know, God or angels pulled me out of the muck and mire. I was in the gym. I was contemplating doing legs because I haven't done legs. I haven't been able to, but I just felt the need to. And I was at the machine, and I knew I couldn't do it. My back was hurting, and I was just bent over the machine. Rob came and said, "Oh, using the machine?" I said, "Yeah, I'll be 2 sets, mate." But I hadn't started my first. So he came back. I still hadn't started my first because my back was in pain. He just like, "Oh, so I can see you got backache, and yeah, have you got a scan?" And then here I am. From then, this man has been kind enough to help me on my progression with the IDD treatment, and obviously referring me to Dr. Petrides for prolotherapy, which has also helped in tightening the ligament. But for me, and also, thankfully for this clinic, the orthotic, what's the name of it?
So yeah, the FITS orthotics, yeah. So we did the gait scan. So we worked out like a leg length discrepancy. One leg was slightly up.
So now we can take it back to the beginning. So in 1993, no one's ever looked at the fact that, you know, one hip is higher than the other. And they just looked at it like as a norm. Oh, we will just, you know, straighten hips. But I had leg length discrepancy, which was causing the higher hip. It wasn't muscular or structural. So, I mean, it was structural in a sense of that it was my body structure, but how they were looking at it was, oh, we can do something to alleviate it and level your hips, which was never going to happen because I was always going to have that leg length discrepancy. So me coming here and seeing Rob with his professionalism, he found that out after 25 years of going around in circles on the NHS. And it was this man that found the issue, and I think that has helped incredibly, because now I'm walking normally, but obviously the years that I have been walking, I've ruined my back. And then obviously I've been doing running, I've been doing, you know, going to the gym, I've done various contact exercises, jiu-jitsu, wrestling, you know, combat sort of exercises, and also football. I used to play semi-pro football. All of that was out of the window. I'm not saying I'm going to be able to do that again, but I feel a lot better now than I have done for the last 25 years. And that is a long time to be on painkillers and going around in circles. You almost lose hope. And at that time, what they wanted to do to me, the NHS, was remove 2 levels of my spine. Remove 2 levels, but remove 1 level at a time. So they remove 1 level, put me in a wheelchair, do whatever they're doing, put back the other level. I'm just mumble jumbling now, but this words to that effect. So I wasn't going to do that, so I started going on a journey of like how I can heal myself, as opposed to listening to what a myopic mindset might give you, that being the bureaucracy at the NHS, not the nurses. They do a sterling job. But yeah, this man has helped me a great deal. And this machine here, the IDD, I've actually been searching for this machine without knowing it, because I've been to other places that have IDD, well, that have traction machines, not IDD. But the thing with that, I don't want to say the company. Can I say the company?
Well, best not.
Yeah, I won't say the company. But with those machines, they just, on the premise of just pulling you apart, regardless of what level your problem or issue is. Whereas this machine is computerized, the pressures, you know, updated continually week after week, and it's targeted to a specific level or a specific area, and it oscillates at the area, and it gives you it's just better as a whole, holistically, for me, healing. And that, coupled with the orthotic, has helped me a great deal. I'm not saying I'm there yet, but I'm a lot closer to a normal sort of, relatively normal sort of lifestyle, as opposed to where I would be on the NHS. 100%.
Brilliant. I mean, that's brilliant. Thank you so much.
Is that all right?
Really good.